loneliness, trauma, injustice. These are just a few of the known causes of suicide. Since we know the causes of suicide, we know that we can prevent suicide. In 2023, suicide was among the top 8 leading causes of death for ages 10 to 64. It was the second leading cause of death for ages 10 to 34. Lost 4 loved ones, and my first attempt at suicide was age 12. Suicide affects everyone in some way. According to the U.S. Center of Disease Control and Prevention, suicide is death caused by injuring oneself with the intent to die. I'm going to talk to you about the statistics, contagion, and preventions of suicide. In 2024, suicide, there was about 1 every 11 minutes in the United States. The death toll was comparable to COVID-19. Suicide rates have risen steadily, increasing to be an all-time high of 70 years. Fewer than 1 in 5 people leave a note. Half of the suicides are spontaneous, meaning they think less than 5 minutes before they act on it. Idaho Crisis and Suicide Hotline has received 25,567 calls in the year 2024. This is a chart that shows the calls from 2012 to 2024 steadily increases. According to their impact report of the third quarter, July 1st through September 30th, not all calls allow assessment, but in the third quarter, there were 5,409 that were at risk to harm themselves or others. There were 282 callers that were thinking of suicide. There was 64 suicides in progress, 185 that lost family or friend to suicide, and 581 survivors of attempted suicide. According to the National Library of Medicine, suicide contagion is the increase of suicide behaviors after exposure to suicide or suicidal behaviors within your family, your peer groups, or media. Exposure to suicide increases risk of suicide by 20%. There's biological factors to the contagion. The human brain, the pituitary gland, releases oxytocin. It regulates social interaction. And the prefrontal cortex, it is about social connection. It is the mirror neurons in your brain that have emotion contagion. This is a chart of what that looks like. Public Health Administration and International Affairs at Syracuse University, it told USA Today on September 10th, 2024, everybody is at risk for suicide. That means basically that everybody should think of suicide prevention as their business. We should have communities that are trauma-informed, educated. That public servants should be mandated to interact with public with those trauma-informed practices. Schools need to have classes, courses that teach coping skills and emotional regulation with zero tolerance on bullying policies. Mental health care should be affordable and available to everybody. There should be individual accountability to behave respectfully towards all people. There are community resources. The Idaho Crisis and Suicide Hotline is the 988 hotline, the lifeline. There are trained responders to answer these calls 24/7. There's also the mobile response teams. They're dispatched through the 988 lifeline. They go out into the community to help anybody that is in crisis, and they're at no cost to anybody. Their hours at this time are from 8 a.m. to 11 p.m. Then there's the community crisis centers that are open 24/7 for any community person that needs to have respite and help. They can stay up to 24 hours. These are all free services to anybody in the community who needs support. Now, I've talked to you about the statistics, the contagion, and preventions for suicide. That means we can all be part of preventing suicide. Globally, 1 in 100 deaths are suicide. It doesn't have to be this way. If we could all just be accountable to see how our interactions with others truly matter, to give a gesture of kindness rather than criticism, acceptance rather than judgment, can be the life or death difference between somebody that's really suffering. Robin Williams was a comedian and an actor who was well known. He suffered from symptoms of depression. He died by suicide. He was once known to say, "Everybody that you meet has a battle that you know nothing about. Be kind."